Hello guys, let's talk about fibroid uterus today. Fibroid is a common benign tumor. It's very common in African and Asian population. So we get many of the patients, some are symptomatic for fibroid, some are not, just an incidental finding. So what you need to know is if you have fibroid, wow, how many fibroids, where it is, do you have any symptom or not, and depending on that management. So let's talk about where it can be. So this is the model, it is the model of uterus where you can see that there are some depiction of fibroid. So uterus has got a the position wise, if we divide it, so uterus has got different parts, like lower part is cervix, you can have fibroid there. It's the body, the common part is the fibroid develop because there is a muscle tumor. It develops in the uterine muscle mainly, which is in this picture, in this model you can see it is this called, we call it intramural fibroid, that is muscle, is inside the muscle. It can be very close to your cavity, can be far away from the cavity, size can be very small, tiny, can be very big, or it can be outside the uterus lining, uterus body, like it's called subserous fibroid. Usually depending on the size, if we need to at all manage this or not. And sometimes it can happen inside your uterine cavity, like this model what it suggests here, that is called submucous fibroid. Usually this type of fibroid, no matter it is small, submucous fibroid is very symptomatic, and the common symptom for fibroid is your heavy bleeding or pain during menstruation. So if you have any problem with your period, please visit your gynecologist. Just a simple ultrasound can detect so many things, like if you have fibroid, where it is, how far it is in your cavity, how far it is away from your cavity, or it is inside your cavity, what is the size, and that if you are symptomatic, then that needs management. If it is a small fibroid in the muscle away from the cavity, no symptom, usually we don't do anything, no treatment, but monitoring is helpful, that so that we know if it is increasing in size or not. Depending on your age, when it is detected, it is required. Sometimes you are near to menopause, then also fibroid can be there. If you are asymptomatic, we don't do anything. After menopause, that will be there, but it needs some monitoring, at least yearly monitoring. But if you are in a reproductive age, you have symptom, definitely we need to manage fibroid either medically or surgically. If you are planning pregnancy, then it is absolutely important, we need to know where the fibroid is. Sometimes fibroid can be outside your uterus, but it is so huge, that is in this place, it is called broad ligament. So there can be a fibroid which is just generating from the uterine muscle going inside the broad ligament, that is the ligament which contains your tubes and ovaries. So why it is important? It is outside your uterus, but still important because it derange the position of your the ovary and tube, because it is so huge, it presses your ovary tube towards in a different position. So anatomy of this structure become so different that tube cannot function properly to catch the egg. So that can cause problem of your fertility problem. So some fibroids, because of the sheer size, it needs to be dealt before pregnancy. Some are though outside the uterus but slightly smaller size, but still it needs treatment depending on where exactly it is, how it is affecting your fertility. And some are very symptomatic, maybe it is small but symptomatic, that needs again management medically or surgically. So please, if you have any symptom of period problem like pain, excessive bleeding, of course you go to your doctor, and simple ultrasound can diagnose so many things. If you are asymptomatic, then also before pregnancy, when you are planning pregnancy, pre-pregnancy, one ultrasound can be of so helpful. You should not waste time. Like if you have a problem, it is diagnosed early, treated early, you will not have a time to waste. But if you are suffering from infertility or trying for pregnancy, it's not happening, and you don't know what exactly is the reason, so do not waste time at that point. Pre-pregnancy ultrasound is also very helpful so that you can plan it beforehand, because if it is a big fibroid and if you are pregnant, after that sometimes also it cause pain and problem of your pregnancy, you might miscarry. So if you know beforehand, deal with it before you fell pregnant.